Assalamualaikum. My name is Nurul Shakira Humaira binti Anwar and I'm from class DPM 4A. My matrix number is 16 DPM 20F2014.
Hi and Assalamualaikum. My name is Nur Fazliana binti Muhammad Fazli and my matrix number is 16 DPM 20F2005 and I'm from class DPM 4A.
Hi, my name is Divya Rashini, anak perempuan Tanah Balan, and I'm from class DPM 4A, and my matric number is 16 DPM 20F2018.
Okay, what is abnormal menstruation? Most women have a menstrual period that lasts 4 to 7 days. A woman's period usually occurs every 28 days, but normal menstrual cycles can range from 21 days to 35 days. Example of menstrual problem includes periods that occur less than 21 days or more than 35 days apart, missing 3 or more periods in a row. Menstrual flow that is much heavier or lighter than a usual period that lasts longer than 7 days. Periods that are accompanied by a pain, cramping, nausea or vomiting, bleeding or spotting that happens between a periods, after menopause or following sex. For example of abnormal menstruation include the following. The first one is amenorrhea, is a condition in which a woman's periods have stopped completely. The absence of a period for 90 days or more is considered abnormal unless a woman is pregnant, breastfeeding, or going through a menopause, which generally occurs for a woman between age 45 and 55. Young women who haven't started menstruating by age 15 or 16 or within 3 years after their breasts begin to develop are also considered to have amenorrhea. The second one is oligomenorrhea, refers to a period that occurs infrequently. Dysmenorrhea refers to a painful periods and serve menstrual cramps. Some discomfort during the cycle is normal for most women. Abnormal uterine bleeding may apply to a variety of menstrual irregularities, including a heavier menstrual flow, a period that lasts longer than 7 days, or bleeding or spotting between periods, after sex or after menopause. Menstrual hygiene. The onset of menstruation is one of the most important psychological changes occurring in the girls during the adolescence years. Menstruation heralds the onset of psychological maturity in the girls. It becomes the part of the parcel of their life until menopause. Apart from the personal importance, this phenomenon also has a social significance. Menstrual hygiene is a hygienic practice during menstruation, which can be prevent a woman from the infection in a productive and urinary tract. In India, menstruation is surrounded by a myth and a misconception, with a long list of do's and don'ts for a woman. Menstruation and menstrual practice are still clouded by taboos and social cultural restriction, resulting in the adolescent girls lacking knowledge and remaining ignorant of the scientific facts and hygiene health practice, which sometimes result into adverse health outcomes. Hygiene-related practice of women during menstruations are most considerable importance, as it may increase vulnerability to reproductive tract infections (RTIs). Poor menstrual hygiene is one of the major reason for the high prevalence of RTI in the country and can contribute significantly to female morbidity. Lack of knowledge regarding to menstrual and menstrual hygiene lead to a poor attitude and practice. There are various issues like awareness, availability and quality of napkins, regular supply, privacy and water supply. disposal of napkins, reproductive health education, and family support, which need to stimulate attention for a promotion of menstrual hygiene.
Today, millions of women and girls around the world are stigmatized, excluded, and discriminated against simply because they menstruate. It's not acceptable that because of a natural bodily function, women and girls continue to be prevented from getting an education, earning an income, and fully and equally participating in everyday life. While Menstrual Hygiene Day is on 28 May, the Women's Society has been working all year round to first break the taboos and end the stigma surrounding menstruation. Second, raise awareness about the challenges regarding access to menstrual products, education about menstruation, and period-friendly sanitation facilities. And lastly is to mobilize the funding required for action at scale. One of the reasons why Menstrual Hygiene Day is celebrated is because many of us know what it's like to lend a tampon or a pad to someone who needs one. It doesn't matter if it's your sister, a friend, or a complete stranger. It's an unwritten rule that we always help out in an emergency if we can. So what about a woman living in a refugee camp who had to flee her home with nothing? Would you help her out too if you could? What are the health risks associated with poor menstrual hygiene management? During menstruation, women are more likely to get risk of infection, including sexually transmitted infection. Use of unhygienic materials to absorb menstrual blood can also cause vaginal infection and long-term effects on reproductive health. Having unclean sanitary pads and material causes local infection in private part that may also travel uterine cavity. So changing pads infrequently may cause skin irritation and increases the risk of infection. Using highly absorbed tampons during light blood loss may increase the risk of toxic shock syndrome. Use of tampons when not menstruating leads to vaginal irritation. Wiping from back to front while urination and defecation may introduce bacteria from bowel to private part area. Unsafe disposal of used sanitary materials increase risk of infection to others. Frequent douching increase the risk of bacteria in uterine cavity.
Menstrual Hygiene Management (MHM) or Menstrual Health and Hygiene (MHH) refers to access to menstrual hygiene products to absorb or collect the flow of blood during menstruation, privacy to change the materials, and access to facilities to dispose to your menstrual management materials. It can also include the broader systematic factors that link menstruation with health, well-being, gender equality, education, equity, empowerment, and rights. Menstrual hygiene management can be particularly challenging for any girls and women in developing countries where clean water and toilet facilities are often inadequate. Menstrual waste is largely ignored in schools in developing countries despite it being a significant problem. Menstrual can be a barrier to education for many girls as a lack of effective sanitary products restricts girls' involvement in educational and social activities. How to take care of menstrual hygiene during menstrual cycle? First of all, frequently change menstrual hygiene products. Whether one in using regular pads or tampons, changing them frequently is one of the most important aspects of menstrual hygiene. It is advised that pads must be changed after 4 until 6 hours during daytime when we are most active. Due to high activity levels during the day, the blood flow is higher, hence this is the widely prescribed time period. During the night, the blood flow is lower due to the low activity levels and it can be worn overnight. Similarly, tampon must be also changed that every 4 hours to maintain menstrual hygiene. Prolonged usage can result in rashes and combination of harmful bacteria which can spread infection. Second, discard sanitary napkins safely. It is one of the most crucial aspects of menstrual hygiene and must be strictly followed. The product must be properly wrapped before disposal. They must be safely disposed of under no condition should be flushed as it can cause blockage. Personal hygiene is another critical aspect of disposal and one must wash hands thoroughly after the process to ensure there are no remains of bacteria and blood on your hands. Any lapse in disposal can be cause infection not just to you but people surrounding you as well. Next, wear comfortable and light clothing. Wearing comfortable clothing during the menstrual cycle can not only relax you but also play a critical role in maintaining menstrual hygiene. One must ensure that clothing is light on the body and has a relaxed fitting providing maximum ease of movement. Tight clothing can cause undue stress on the body and result in sweat and become a breeding ground for infection bacteria. Cotton clothes and underwear are highly recommended for menstrual cycle wear. Number 4. Do not use chemical hygiene product or soaps. Maintaining proper intimate hygiene becomes even more important during the menstrual cycle. The genital area must ideally be washed with warm water without any chemicals products or soaps. These chemicals can cause irritation in the genital area resulting in itching and even severe vaginal discharge. Wet wipes and other soap chemicals-free products are also a great alternative for intimate hygiene. And the last one is use only one sanitation mode at a time. In order to enhance blood absorption, many women use combinations such as 2 pads or a tampon and a pad. This might work in improving blood absorption, but you might fail to notice that they are used up. This is a major menstrual hygiene hazard and can lead to rashes and even infection. Instead, using only one pad or a tampon is advisable as you will know when the product is used up and change it on a timely basis.